Welcome back to New Day. A new study says something you might know already. Americans popping sleeping pills at an eye-popping rate. That's according to the first ever federal health report to focus on actual use of prescription pills. At least 8.6 million Americans take prescription sleep aids. Between 50 to 70 million people, though, suffer from disrupted sleep. So why is a good night's sleep getting harder and harder to find? We're joined now by Dr. Jennifer Caudle to help us try to find some answers. If we had a perfect pill for it, we wouldn't be here talking about it, right?
Rested.
But the numbers are pretty amazing that I just said. Yes. 8.6 million people are using sleep medication every month.
Yes.
What do you make of these results?
So, I'll tell you what I think about this. The word, like the phrase 8.6 million seems like a lot of people. But as a family practitioner, honestly, every single day, I see people who are on these medications or who are coming in asking for them. So quite honestly, I actually believe that number. I believe that there are millions of people out there that not only have problems sleeping, but are on these medications as well.
In part of the study, I mean, it was pretty extensive. I was looking through. The study found that the number of people taking the medication kind of kicked up in and around their 50s, and also the rate was much higher among women. So are we talking about more people are having trouble sleeping, or more people are now becoming more comfortable taking a sleep medication?
My personal opinion, I honestly think it's probably both.
Yeah.
Let's talk about why someone might have problems sleeping. Like, first of all, let's look at our 24-hour-a-day, 7-day-a-week world that we live in, right? The stress of everyday life. We've got cell phones, and we've got computers that never shut off. I think that that's really having a toll on our environment and our community. But sometimes people work shift work, right? They might work sometimes at night, sometimes at day. Sometimes people have conditions like sleep apnea or restless leg. And then don't forget things like anxiety, depression, life stressors, if you lost a family member or you lost a job. These are things that really do impact a person's sleep. So there's many, many reasons why we're seeing this, but I think it's a combination of that and probably, people I think are more comfortable saying, hey, doc, what can we do about this?
And this isn't just, we're not just talking about being tired at work. I mean, extended sleep deprivation has real impact on your health.
Oh, yeah, it's not a joke, okay? Insomnia and being tired really is not a joke. And what I mean by that is we know that car crashes, motor vehicle accidents, fatalities from people who are driving who are sleepy. That's just one example. It's astronomical. It's dangerous, downright dangerous. So it's definitely really important that, look, if you're not sleeping at night, and don't forget there are other things too, right? Going to work being tired means you're probably not concentrating as well as you might be able to normally. Just being a little bit distracted, not performing optimally. So it's not just the car crashes, which in and of itself is bad, but it's the whole world sort of
I also feel that when I've gone a long time with very little sleep, I feel like my immune system is compromised. You're going to get sick a lot easier.
Absolutely.
So what is the best advice that you give to your patients when they come in? What's the best way to get sleep without a sleep medication? But do you also... Are you fine with recommending a sleep medication?
Yeah, so, I mean, to answer that question first, as a family doctor, yes, sleep medications are appropriate for many people. It's got to be the right person, the right patient, the right situation. But for some people, this is the right thing to do. But let's talk about things you can do at home, okay? So first thing I recommend is when people come to me, I want them to tell me about what's going on at home. Keep a sleep diary. 1 to 2 weeks, write down when you're going to sleep, when you're waking up, what's happening around your sleep time.
So you don't think that's silly? I've heard that, and some people say, oh, that is just so silly.
Are you kidding? Doctors love it. Bring it into me. Show me the piece of paper because it's tangible information about what's going on in your life. But so let's talk about what we call sleep hygiene. Sleep hygiene is basically the do's and the don'ts of getting good sleep. Okay, so first thing is avoid the alcohol and the caffeine, especially around bedtime. You're really not going to sleep well. Avoid really heavy meals. This is not the time to eat that huge meal at 11 o'clock at night. Make sure that your room is really dark and kind of cool. So if you need those darkening shears, the drapes and stuff, I have those in my own bedroom. Otherwise, I can't sleep.
All good advice.
Do it.
All
Absolutely.
Good advice. All right, well, on that note, I'm going to go back to bed. No, Dr. Jennifer Caudle, thank you so much. Great to see you.
Thanks so much.
Good advice we all need to listen to.
Thank you.